Yeah.
All right. So, thank you, everyone. My name is. Thank you guys for your patience. We're about to have a 30 to 40-minute talk on diabetes and accepting in halacha. My name is Yaackov Yitzhaki. I'm giving a share in Rav Tal's Yeshiva Mital Shemayim, and I give it to Seva Bracharim, and I also am an M4 medical student. So I would like to make the Bachram aware, and whoever would like to be aware in Yerufua to preemptively know how to take care of themselves and be aware of various different illnesses that play the world, affect the world, and as they're young, they definitely can do preventative treatments to avoid them and keep themselves healthy throughout their lives. And in addition, anyone else who would like to join, it would be fabulous, because just to be awareness is oftentimes the key. Prevention is the best thing before anything ever gets serious. So in essence, just to review, what we're going to do is we're going to talk about this series is going to talk about relevant topics such as hypertension, diabetes, heart failure, and the like. Followed with relevant halachic topics to that subject, and why these diseases are important to be aware of, and what one can do about it. Okay, so with that said, who here has ever heard of diabetes?
Yeah.
Okay, who here can roughly tell me what diabetes is? Okay, we're going to go with Rabbi Lax.
When the pancreas ceases to function as it's supposed to, it can't properly regulate the blood sugar.
Very good. Okay, how many people? Very good, very good. And how many people know? Okay, so we're going to get to that. And how many people here know someone with diabetes?
Yeah.
Okay. All right, I was expecting more hands to go up, but that's fine. All right, so Rabbi Lax gave a very good explanation. So diabetes is the uncontrolled level of your blood sugars that can result in many bad things. So the treatments for diabetes, not for diabetes, but number one, don't get it. Once somebody gets it, is to take care of their body and to take the appropriate medications. So it's not meaning diabetes. Once somebody gets it, there's no reversal of diabetes in the sense of they're not going to be cured. There's no cure for diabetes. It's tied to an organ called the pancreas, which produces insulin, and depending on basically, it's produced by certain cells called beta cells, produce insulin, and if those cells basically die out, the person will for sure have a resulting diabetes. But it's not necessarily before these cells die. So how does diabetes happen? Okay, so to review. We have many organs in our bodies. One of these miraculous organs that Hashem gave us is something called a pancreas. Pancreas, and part of its function, it releases insulin and glucagon. The one that we're going to care about right now is insulin. So insulin, like if you think about the word, insulin means insular. So you have a whole bunch of, you eat something, you eat a candy, you eat anything. Where does that food need to go? It needs to go everywhere. How's it going to get? All right. Now your body has a whole bunch of cells. But obviously, you eat a steak. You eat a potato, right? The potato isn't going to your, the potato isn't going to your brain, isn't going to your heart. What happens with the potato? The potato gets broken down by your stomach, and so by stomach acids, and it will enter into your bloodstream. We'll get into your bloodstream, all the components of it. Well, for our topic, we're going to say the sugar in the potato will get into your bloodstream. Or let's take a candy. The candy will get into your blood. The sugar from the candy will get into your bloodstream after being broken down slightly. But how does it get into a cell? So now you're going to need that sugar to make your cells function, to make your cells run and do whatever they need to do. How is it going to be able to do that? So how does it, meaning what's the entrance, right? You don't want just anything going into your cells, right? There's certain things that you want. You don't want random garbage in your cells. So how does it get in? So the pancreas is able to, when you eat, it's able to realize, and it's measuring the sugars that are getting there, and then it sends off insulin through a whole bunch of a cascade, and through different mechanisms. Insulin gets kicked out of the pancreas, and then it basically says, okay, cell, you can start taking in sugars, right? So now with everything and with any machine, so you drive a car, and so what keeps a car running well? Like, right, I'm gonna be stereotypical, right? If you have your, what's the difference between, not the stereotype, but there's people that there are people that take care of their cars. They can have their cars for 30 years. They literally baby their cars. You can have this 1978, Mustang that's running well, and then you have people that get a 2025 Sienna, and it's falling apart in a year and a half. What's the difference, right? Somebody knows how to take care. Somebody's pressing on the brake all the time, and not treating it nicely. They're literally just stopping. They're pulling the brakes and whatever. They're not all right. They're putting in the wrong gas at the wrong time. It's not regulated. Yeah. All right, that's the point. Okay, all right. So whereas the person who's babying a car, Rahman al-Atzlan, you pressed on the gas, you pressed on the brake a little bit too fast. They're ready to kill you. So hainu hach, the same thing. If your pancreas wants to, this is all, meaning obviously your pancreas doesn't have feelings, but your pancreas wants to act in the most normal fashion that it can. So if, let's say, you eat something, so let's take, a nice food, an apple, right? A good fruit to eat for everyone. Like the apple a day keeps the doctor away. So you eat an apple. One apple. You're not eating too much and whatever. Okay, the pancreas knows, it feels it. It's able to kick it out. Now let's see, on the other hand, you down a bag of Jolly Ranchers, right? So, right. So what is your pancreas like? It's like, oh my gosh, what did this guy do? He just ate a whole bunch of Jolly Ranchers. He's got to kick it out. Send out the insulin. Get into the stores. I don't want this sugar hanging around in the blood. Just bring it into the cells. So aside from maybe sugar messing up people's cells and whatnot, the sugar is also going to act. The pancreas is being driven with sugar, right? Now, so to speak, you can imagine if you drive the pancreas crazy enough times, it will start to rebel. The cells are going to be overworked, and they're going to start dying. I forgot. I'll get this type 1 in a second, type 1 diabetes, but we're talking about the mechanism type 2. So the pancreas will eventually feels worn out, and basically, so one cell dies, then another cell dies, and it keeps on going, and basically the person is slowly overworking their pancreatic cells, and they're killing them, and because it feels the consistent need, meaning the less workers you have available, the harder the other workers need to do, right? So then all the other cells are pooping themselves out. They're overworking or whatever, and the person consistently is every single day they're eating 3 bags of Jolly Ranchers. They'll get diabetes pretty fast, right? Unless they have very, very good genetics. It does happen. So in the end, the person will reach a point where the pancreas isn't functioning appropriately. There's certain numbers that can tell you that the pancreas isn't functioning appropriately, and at that point, the person has diabetes. Once the person has diabetes, it's not that the pancreas isn't providing insulin. The pancreas is still providing insulin. Not all the cells are dead, but you know that it's going to die. You know that it's headed in a bad direction, right? From this point on, there's no tshuva. There's no, tshuva right now. The person already has the blemish that he has. All right, he can take medications. He can act better. He is not gonna. His pancreas. There's no getting back to pre-diabetes. And in that sense, he's going to need to manage himself. They could live, but there's aluliyot habasibuchim. There could be a potential for many errors. So, meaning, and the way that you're able to tell this is basically if the pancreas isn't able to take care of the sugar fast enough. So what is actual numbers for diabetes? So if anyone knows what hemoglobin A1C is?
I've heard of the word, but
Okay, so hemoglobin A1C. Hemoglobin is basically it's part of your blood. It's part of your red blood cells that they. Okay, so to explain what it is, it's basically your hemoglobin A1C is a method of measuring how much sugar is attached to your cell, right? So what happens is your cell. How long does anyone know how long an average red blood cell lives for? They're kind of dead as they start off because they don't have a nucleus. If everyone knows what a nucleus is. But they're basically their nucleus is ripped out of them. They last for the same amount of time. All right, the amount of days that Moshe Rabbeinu lived, not days.
40
Yeah,
days,
so
49?
No. Meaning 120. Meaning how many years is the amount of the average red blood cell lives for 120 days, right? So what we do is we measure how long so what happens is, let's say a person has extra sugar in their blood. For whatever reason, they have extra sugar in their blood, meaning typically due to the pancreas not behaving appropriately. What's going to happen is that the sugar likes to attach to red blood cells. So it will basically coat it like a candy, so to speak. So you can imagine that you're basically, not you, but a person with diabetes or close to diabetes will start coating their red blood cells with sugar, because the sugar has nowhere else to go. In the end of the day, what you can do is something very smart. We can take a sample of their blood and then measure how much sugar is attached to that, and that's a hemoglobin A1C. That's what hemoglobin A1C is. So if it's 6.5%, I believe it's 6.5%. When you say 6.5%, I think that's a percentage of the red blood cells that have this. I might be wrong about exactly what it is, but that's the measurement. And once a person reaches 6.5, there's no tshuva. And mamish, these studies have been done. 6.45, 6.48, they can do tshuva. 6.5, there's no tshuva. All right. All right. So that's the measurement. And then there's regular blood sugars that they can take that can also maybe that will diagnose diabetes. All right. Now, just to say, for a side, we're not talking about type 1 diabetes, but just to cover it, type 1 diabetes happens when basically what we understand now, or from our understanding, it's an autoimmune condition. Anyone know what's autoimmune?
The immune system attacks itself.
Right. So basically, for whatever reason, there are different things. You want to eat. Maybe you should eat. This food or that food causes autoimmune conditions. So like celiac is an autoimmune condition. Autoimmune condition is when the body basically gets exposed to a part of itself that it shouldn't be, and it attacks it. So the running theory with an autoimmune disease, and this is good to know for the rest of this series, an autoimmune condition is when one of the running theories that I'll share with you is basically, okay, you have white blood cells in your body, right? What do white blood cells do? Anyone know?
supposed to fight viruses, no?
They clean out viruses. They protect you from viruses and from bacteria. So, and part of what they do is once they recognize, let's say, a virus, why when you get a vaccine or something, what's the point of the vaccine?
To expose you to the antibodies.
Right. And then your body, so you have the white blood cells are marker, they recognize this disease. Person, let's say they get exposed to that disease again, they're not going to get it again. Let's say it's like smallpox, meaning smallpox was a deadly disease, but people who got chickenpox don't get smallpox. Or sorry, cowpox. Cowpox was what it was. They didn't get it because basically it's close enough that the body recognizes it, the white blood cells recognize it, and it's fine. And so basically the white blood cells are protecting the body, and they can recognize where there's disease and attack it, and they recognize anything that's foreign, right? Now think about it for a second. There's only certain areas of the body that the white blood cells go to or will go to, right? So let's say somebody gets a very deep gash in their body, right? Or or for the topic at hand, one of the autoimmune diseases is, let's say, known as Crohn's, right? So the theory with Crohn's is that so white blood cells aren't per se going deep into the gut, but somebody will get an injury to their stomach, to a point. They'll eat something that will impact their stomach, and a white blood cell will get there, right? And it's never there. It's never typically there. And then it gets out of there, and it says, Chevra, I just recognized that there's this foreign thing in the body. I've never been there, never seen it. You should know we need to create antigens. We need to start producing, an army to attack this area, right? To attack this thing. Now, what the cell doesn't know is that it actually is part of the body, right? So then they've created a whole thing to go attack a part of the body. Then hence Crohn's will develop, right? So that's the running theory of why autoimmune diseases happen.
When a cut or what?
From, let's say, a deep cut. Let's say somebody. I'll give you a random situation. Gets a gets a stomach ache one time, and he's his stomach's just running very, very bad, and somehow, some way, there's a white blood cell that gets there, recognizes it, gets back is able to survive, gets back to the bloodstream and stuff, and tells the Eilam Chevra, there's an invader here, and it will attack that part of the body. So in a similar vein, what the suspicion is that white blood cells will get, for type 1 diabetes, white blood cells will get exposed to the pancreas beta cells, which are the cells that produce insulin are pancreatic beta cells, and it will start destroying that. And that's why type 1 diabetes is very fast happen. Once you see it happening, it's miyad, it's immediate, because basically it's just attacking it like it would attack any virus, okay?
And then what happens?
And then the person doesn't have a functioning beta cells, they will not produce insulin.
When they attack it, is there pain?
No pain. No pain. They'll see the symptoms, we'll describe the symptoms of diabetes in short, but typically type 1 diabetes you'll see in skinny people because it's totally autoimmune, and eventually they lost weight and such because they weren't able to bring sugars into their cells.
I think my uncle maybe has that.
Possibly.
He has Crohn's.
Yeah, he has Crohn's.
My father has ulcerative colitis.
So UC has the same running.
So
It's a running
thing.
thing.
And you don't know because there's no pain.
Well, with pancreas, they'll see the person will start urinating a lot. They'll start having, they'll start having a lot of problems. You might start seeing stuff in their urine. They'll start sweating. Typically they show up to the hospital either with a history of urinating a lot, or they basically have gone into some sort of crisis where it's like they're in ketoacidosis or diabetic ketoacidosis or something like that, and then you rectify that, you straighten them out, and then you realize it's usually somebody who's younger, type 1 diabetes, give them insulin and manage them, and they'll be good. That's enough about type 1 diabetes, but which is autoimmune as described. So basically, once again, it's the white cells attacking the pancreas. Sorry?
Type 1 you can't really prevent. It's not something
No, you can't. It's non-preventable. I'm saying, hypothetically speaking, there's always these running theories. You eat healthier, whatever will prevent an autoimmune disease. You don't eat GMO or eat GMO, however that goes, right? Meaning, I'm sure there's semi-studies that go into it. Fun fact, right? So this is an interesting thing. Most autoimmune diseases, there's a genetic component to it, right? Meaning somebody has UC, right? Ulcerative colitis or Crohn's or, all these things. There's, they're associated with a genetic, predisposition. All right. Now that doesn't mean it's necessarily high, but it's higher, right? So the percentages will go up. With type 1 diabetes versus type 2 diabetes. So type 1 diabetes is this autoimmune condition. You have a random guy that gets it, and they're 7 years old, and they get type 1 diabetes, and they have a brother. They have a twin brother. Yeah. So take that guy, his twin brother. Then you have another guy, who he's 35 years old. He gets type 2 diabetes. He has a twin. Yeah. Who do you think is more likely to get diabetes, type 1 or type 2? It doesn't make a difference. The guy whose brother has type 1 or the guy whose brother has type 2?
Brother's type 1.
Okay, that's a good svara, type 1. But the reality is it's type 2.
Because it's more genetic.
Yeah, because
So it's
because the food, it's all about sugar. So if he feels
Yeah,
like
what does it matter?
so
They might not use it.
so it's
still,
it's a good theory. It's a very good, meaning what Yitzhak is saying is a very good theory. Rafal, if you have any input, b'chol kavod. But it's a good theory. Basically, it's saying that if your family is eating bad foods, right? I mean, so that's the fact. The fact on the ground is that if you have a twin, if somebody has a twin and the twin gets diabetes, if it's type 1, there's less of a chance that they'll get it than if it was type 2. Beginning and end of the story. There's a good svara to saying that if they get type 2, that they're more likely to get type 2, just because type 2 is oftentimes associated with lifestyle. Families typically have the same lifestyles. So if you have a culture or a family that's just pounding, their culture is the religion of Jolly Ranchers, they're very likely to get diabetes. Yeah? So now why is it very bad to get diabetes? So Einstein's, number one, if the person doesn't have insulin, is not producing insulin, this isn't per se in an order, person's not producing insulin, they're not getting energy to their cells, right? Sugar is energy, yeah? They say, like I had a professor who said, you've got to eat your sugars during the test, I'll let you eat candies because you got to have your brain thinking, right? Because sugar goes straight to the brain. So you need to have your cell needs sugar. Saif kol saif, in the end of the day, you need some sort of energy form that's going to your cells that is able to break it down and produce energy. No insulin, there's no key to open up the door to your cells to bring in energy, then the person's going to get very weak, and their body's going to seek other unfortunate methods of breaking stuff down, like when someone starves and they have no food. So there's other ways that the body can break down things.
So if you just always eat bread and water, you won't have any energy?
No, because everything has sugars to it, different kinds of sugars. It's not sugar, not raw glucose, but the body breaks it down. Now you eat a candy, so we'll get into the description of why everything gets broken down into the body and into various different kinds of sugars that the body's able to break down. All right, number 2.
Like bread and water has sugar. Everything has sugar.
Water doesn't have sugar.
Water barely has anything.
Right.
Water is hydrogen and oxygen.
But people need water as is. It's needed for different pathways, and for stom if you're thirsty. But there's a reason for that. Okay. All right. So now, and then number 2, it's never good to have sugar floating around your body, right? So literally think about it. You ever pick up a sugar, like a thing of sugar? You ever put sugar in your hands?
Yeah,
Okay.
Yeah.
So I'll give you a very good dinyan. All right. Very good example. Okay. You eat that. All right. Doesn't get broken down in your body. It's a nice little coarse thing. Right? This isn't necessarily exactly how it is in the body, but it's a nice little sharp thing. It starts messing around with proteins and stuff like that. And imagine basically now you're dealing with pokey things and you're all along your blood cells and all along your body, and these things will create basically sharp-like objects, right? Little knives, tiny little daggers. I'm not saying it's mamish the sugar itself, but it messes up things to create disformed items, disformed things that will start clunking onto stuff, start nicking things that it shouldn't be doing. Right? In the body, we want everything to run smooth like oil, smooth like a smooth engine. People start having, start doing diabetes. Like I'll give you a muscle, right? Different disease, sickle cell. Everyone knows what sickle cell is?
Yeah. Nope.
All right. So it's a genetic disease that has propensity amongst African Americans, all right, and also some Middle Easterns, that basically literally the red blood cell will sickle. We know what a sickle is?
Yeah.
So a little like a moon, like a crescent. So the blood will sickle. That's a disformed red blood cell. It will literally look like a sickle,
okay.
and it will start nicking different blood vessels. All right. So in a similar vein, diabetes you'll have disformed things that will start nicking things and clunking onto things, clunking onto the kidneys, clunking onto start nicking or clunking onto the eye, fine arteries. Like the eye what's bringing blood to your eye? What's doing or adding onto nerves? and it's these little garbage things that people start building up garbage or start nicking their fine organs. So like their hearts, very, very famously and very importantly, their eyes. In the end of the day, Rahman al-Islam, somebody has extensive diabetes, it will start impacting it starts impacting the nerves in their toes. People will need amputations if we're uncontrolled diabetes. Why? Because basically in the end it kills the red blood cells over there, kills the nerve tissue over there. Person will eventually, there's not good blood flow in that area. You need to clean it out. The bloodstream basically cleans everything out, and then you just start developing a dead end, right? So that's why people will start having, if they're on their toes are the dead end, right? And it needs to get back up. So and they're very, very fine and small arteries and nerves over there. The person will, what typically will happen is the person will kill their nerve in the area.
That can't go back.
What? The nerve, so here's another side. Nerves, there's 3 tissues in the bodies. I'm sorry if this is taking way too long. There's the three tissues in the bodies. You're going to hear it right now. Know it. They never regenerate meaning after a certain age, right? A person will grow a heart or whatever. There's no such thing as, meaning once you hit a certain age or whatever, there's no such thing as a new nerve, which includes, there's no such thing as a new nerve cell, which means there's no such thing as a new brain cell, right? No such thing as a new heart cell, cardiac cell. There's no such thing as a new muscle cell. There's such a thing as generating a new, gut cell, new stomach tissue, new bone, new this, new that. No such thing as creating a new nerve.
Well, what do you mean make a new muscle cell?
You can exercise. You're exercising that cell, right? But let's say somebody tears a muscle, and they kill a cell, right? Rahman al-Islam, someone takes a knife to another person, gashes them, kills them, and they kill the nucleus of a cell, right? Of a muscle cell, several muscle cells. That muscle's gone. Nothing to talk about. A person can sit there, exercise, recuperate, generate new muscle mass, but the cells are gone forever. So getting back.
You can put new cells, you cannot take new cells from this hand and put it here, let's say.
Well, then what have you done? Then you've taken those cells and removed them.
No, what I'm saying is you can't also take from another person.
Then
you so I'll say like this.
you still then that person is missing something.
Sorry?
Fine. I'm saying let's say he's dead.
Initially, when the person's born and stuff like that, the cells are there, and the person has the muscles, right? I don't think there's any new. I mean, when a person's born, maybe I don't remember exactly. Maybe there's a few more muscle cells that get created, but because obviously the muscle cells are generating and being created as they're being born, as their mother's pregnant with them, and the same thing with their brain.
Muscle cells in a baby than a 10-year-old.
So
that's how it's meant to be.
Right, but honestly it's the same. It's come out the same muscles.
Really?
So it's just.
A newborn's brain it has the same amount of neurons as an adult.
So that's what I'm going to catch myself in that. I don't know if the brain is still developing that there are more cells generating, but once a person reaches a certain age, there's no more development of new cells. Even before the 20s, But I don't remember the exact age, right? You can get smarter, you can know more knowledge and everything, but Rahman al-Islam, meaning, and we don't know how the brain functions 1,000,000%. Bichlal, we don't know how the brain functions. We have general ideas.
Yeah.
But okay, but point being. Getting back to, but this once the cell is gone, right? Somebody gets a stroke, cell dies. Let's say they had 100 brain cells beforehand. There's a lot more, but they have 100 cells in their brain. Now they have 99. Okay.
You can't put
Never going to happen. Never. They're not going to get a. You want to take a brain brain transplant?
Yeah.
I wonder how your brain's going to start thinking now. What's your personality going to be? But you're right. Meaning, obviously, if you can take a transplant from somebody and put it there, so now they have another cell. You took out from the other guy, right? So now he had 100, now he has 99, and now.
Dead, so if the guy's dead, then.
Okay.
Yeah, that's what I'm saying. Look, also the muscle. You could take.
You could hypothetically. Hypothetically.
That's what they do heart transplant.
Hypothetically.
Right.
Hypothetically. But okay.
With kidneys.
Yeah. Yeah, so you're right. Yitzhak, you're 100% right. The person has a dead kidney. You bring in a new kidney. The kidney's made up of millions of cells. You give them a new kidney. Now they have a million plus cells. You're right. You're 100% right. If you make a transplant, you'll bring in more cells just because everything is a cell. This table was once cells. They're now dead. They're cells still. But everything is, yeah. So, yeah, but it's a whole bunch of dead cells right now. So getting back to diabetes, so if somebody develops diabetes, their nerves are going to start dying. What will happen is that they'll stub their toe. They're not going to feel it. They're going to get an infection there. It's numb. It's dead. Nothing. They're going to stub their toe. Not going to feel it. They're not going to know that they have something going on in their feet, right? It's going to get infected. There's poor blood supply there because they have diabetes. So the blood isn't getting there. Everything's nicked and messed up. They're gonna lose a toe. Then they'll lose a foot. And then they'll keep on going up. They're not gonna be mobile. They're gonna get they're gonna, they have a very high likelihood of eventually dying from being immobile and all that. Right? Obviously there's small fixes. We put the person in a wheelchair, we try to give them a prosthetic. These aren't the best thing created is man by God, meaning the best way to be made is by God, right? God made the best man. There's nothing in comparison to the original, all right? And so if a Kadosh Baruch Hu made that we are meant to have legs, right? Prosthetics, as much as cool as some sci-fi movies might make it, they're not good, all right? It's incomparable, and it's not created to be functioning with the body. Okay. So I'm going to skip the part, but basically there's an idea, not the idea, but eventually if a person isn't producing insulin, there's other methods and pathways that the body breaks down food, right? Obviously, if you're in a tanis, right, you're not producing insulin, right? So how do you break stuff down? So the body will seek other methods of breaking things down, but those methods will result in messing up the brain because there's certain sugars, certain poisons that will be created from this called ketones will get to the brain. And there's something called the blood-brain barrier. Nothing gets past the brain that's bad, but ketones are something bad. Meaning, ever heard of a keto diet or whatever, right? So the ketones will create. There's certain kind of acids that will be produced. They'll get to the brain, and not the acids, but these ketones, they'll get to the brain, and it will negatively impact cognition and negatively impact the whole body. Person does not want to be in ketoacidosis, diabetic ketoacidosis at all. Okay, so we described that. Okay, so we said it will impact nerves, it will impact the heart. Diabetes can impact the heart. It will very famously impact the eyes. Very bad. People get blind because of diabetes. This is something very dangerous. People don't know, and it's very delicate because there's very small arteries and nerves going.
There's in the eye. I think there's 2 million moving parts.
Makes sense.
They just all die, or what happens then?
Meaning there's no blood supply. There's no good nerve there.
They just all die.
Basically the person's dumping a whole bunch of garbage of sugars and misrun proteins there, misfolded proteins, and that will build up. So in the end, the person will need to take medications to regulate, meaning they'll need to take insulin, or meaning if they reach a complete level of this, they'll need to start taking insulin to bring it into the cells. There's other medications that will lower their blood sugars and stuff like that. Basically they get the blood sugar, so it will just lower the blood sugar. Dapagliflozin, different things. Very famously, what's the one that's going around now? Ozempic, right?
Yeah.
So Ozempic, they're all methods of basically lowering the blood sugar, right? They're not methods of necessarily there's some of them will make stuff go better into the cells, I believe, somehow. I forget which ones, but for the most part, what they're doing is that they're getting rid of the sugars, right? They're not allowing the sugars to hang around too much to cause the damage.
But isn't it that you also need the balance of the sugar?
Right. So they're gonna need sugar, and obviously, if they meaning some medications will run the risk of basically not of of hypoglycemia. Hypoglycemia is when somebody doesn't have any sugars, so they'll start getting headache, lightheadedness. If you fast too long, people will get hypoglycemic. Hypo means too little. Hyper is too much, right? If somebody's hyperactive, they're too active. Someone's hypothetically hypoactive, means they're not too active, right? So easy. That's the description of diabetes. So is everyone here scared of diabetes?
Now I am.
Okay. Mission accomplished. All right? All right? So everyone should be trying to not get diabetes. Rahman al-Islam, do not get diabetes. Spread the word. I was in the hospital yesterday, I wouldn't say younger gentlemen, meaning it's a problem, meaning I'll say that I'm going to go on a little bit of a rant right now. There's from my understanding, the way the world runs, people are like, an older person, yeah, they got diabetes, this and that. It's like the mahalach of the world, right? People just get diabetes. Yeah? And like, okay, they're old, whatever. No, do not. It's preventable. People don't need to get diabetes. People can go into their 90s, 100s, no diabetes. All right? This is not like, okay, somebody has a grandmother with diabetes. Yeah, meaning people aren't perfect. People eat the wrong things. People don't know. People aren't aware. This will happen, right? But it's definitely 100% preventable. Some people have a higher propensity for it. Some people have a higher genetic predisposition for it. All right? I'll tell you, I saw a woman, meaning 100% a predisposition, right? This woman was very heavy set, very overweight. Doctors saw her. She was stereotypical, like upper 40s. These not nice doctors, they were like, this woman for sure, behind her back, she for sure has diabetes. We need to take all right, everything, nothing, all right? The lady had a perfect hemoglobin A1C. She obviously, she needed to act healthier, and she does run the risk of diabetes because of her health. Meaning basically what will happen, and then you'll get a very skinny person, right? You'll get very skinny people, and they'll be diabetic. They not necessarily because they potentially didn't take care of their health, and also just because of genetic predisposition. But this is preventable, 100% preventable, right? People need to eat right and exercise correctly, right? So now I'll say Yisayid, right? The Yisayid is that, okay, so eat right. So you eat the right foods, yeah? You're not eating the bags of Jolly Ranchers and stuff like that. But there's another Yisayid, right? Obviously, if you eat too much food, right? Let's say we're going to say, we're going to say that bananas are good for, good food, an okay food to eat. Or okay, let's pick the kosher one. Okay, strawberries, yeah? All right? I don't know, whatever. I don't know if that's, depends, it's washed. Okay, oranges.
Can't
All right.
get wrong with that.
All right, so guys eating oranges. Oranges, this is going to be very hard. I don't know how a person's going to do this. They'll probably have other problems. But if somehow someone can condense all the calories of oranges into like pills, right? You eat 1 million of those, so you had 1 million calories. You overate. You have too much. All right, there's a problem. Or you eat the whole wheat bread or whatever, right? You eat 1 million pieces of whole wheat bread. That's 1.5 billion calories.
Too much of a good thing is a bad thing.
All right. Obviously, the pancreas is going to be pooped out, right? You're overworking the pancreas. You're like, pancreas, here. All right, I ate the right thing. I did tshuva, right? But I ate 20 different. I ate the same, a whole bunch of things. So it's not just eating the right foods, which are very important. Eating the Jolly Ranchers, eating 2 Jolly Ranchers or a bag of Jolly Ranchers. It says 100 calories in the bag. What's the bias? So the person won't get fat, right? That's true. They won't get overweight, but they the problem is it's gonna affect the kidney, right? It's not the kidney. It's gonna affect the pancreas. The pancreas is gonna need to send out stuff. Yeah. Okay, but there are so just some recommendations. Okay, eggplant, dark chocolate, chickpeas, cashews, carrots, broccoli, banana, strawberries, peppers, your fruits and veggies, they're typically all good.
Dark chocolate?
That was a recommendation. All right, don't eat whatever. Skip the dark chocolate.
Okay,
all right.
Disgusting.
High food. All right, high foods, corn chips, donuts, French fries, fried chicken, mashed potatoes, pizza, pretzels, sport drinks.
They're good things.
Don't eat it. Right. White bread. Okay. Obviously, everything in moderation, everything good. People with a risk of diabetes should get themselves screened to figure out if they have diabetes, which is meaning typically I believe the I don't remember. I forget if it's at 25 or 30. They're going to for sure the doctors are for sure supposed to measure. Somebody's overweight or over a certain BMI, they also need to measure the hemoglobin A1C. Why? Because
I don't remember why.
do you? Probably not unless you have a very strong Rahman al-San family predisposition.
What's BMI?
Body mass index.
What?
Body mass index is a way of measuring how heavy a person is.
My BMI, I think, is.
Well, you happen to be taller than all of us.
My BMI is like my IQ.
We're good.
Take it as you'd like.
But okay. But the other thing to do is, so diet obviously, all right? And the second thing is exercise. And you need to exercise. You know, it's
Smiling for that.
lowest recommendation is 75 minutes of exercise a week. That's very doable. Take a 12.5-minute run or something. I run. I should be running more. I should be running.
I also run.
How about biking up a hill?
Ma?
We do soccer on Friday.
I run around the what do you call it?
Some of the elites.
Soccer.
Yeah, we do soccer on Wednesday.
Only the elites.
And Fridays.
Torah soccer.
אתם צריכים לעשות עוד. Pure soccer.
2 times a week we do soccer.
עוד.
No, that's just him. That's just him. We do one.
אנחנו צריכים
Yeah,
עוד.
these non-elites.
We
just the ones.
learn so deep
I
that
do.
we start sweating.
Yeah.
You know what something is that's very surprising in a chess game between 2 grandmasters. In general though, they can burn up to 2,000 calories just by thinking.
Wow.
Like
Makes
yeah,
sense.
it's crazy. They're
Makes sense.
sitting there for like an hour
If you
long
play
games.
chess, you'll understand.
Huh?
I know. I've experienced that for I don't know about 2,000 calories, but I've experienced it firsthand.
But if you break it down, 75, meaning even less than that, I'll say do it. It's good, right? But that's literally 12.5 minutes a day. You know, if you're doing basketball, 12.5 minutes a day, also good. You know, like all these things are excellent, all right? And another recommendation, you know, push weights 2 or 3 times a week. But, you know,
Why?
just do ma?
Why Dafka weights instead of like?
Where you say do.
Not resistance. It doesn't need to be anything. You can. I mean, just it's a different way of exercising your muscles. It's I don't have a specific SIBO why that should be good as opposed to just aerobic exercise and getting your body.
It's fine. You can do resistance band. Okay, that you
It gets your body to regulate. That's a good question. I don't know the answer to it. Why?
Yitzhaki, I heard about this martial arts called hand-to-mouth combat.
What?
Hand-to-mouth combat, you know?
Gotcha.
I'm a black belt.
Triple black.
I got a black belt.
No, that's funny. I have a black belt too.
It's a very loose belt.
But okay, what people should do meaning for overweight, these are guidelines. Obviously, see a doctor and stuff like that. You know, so aim for weight loss. 3% of weight loss is good. You know, these are basic things. So, all right. So number 2. So I've scared you all about diabetes, convinced you not to get it, Rahman al-San, and all to take preventative measures, and hopefully everyone's going to start exercising soon, right?
Wait, what's worse, lung cancer or diabetes? Because if
Lung
I
cancer.
quit smoking,
Lung cancer.
probably wouldn't eat
You
as
smoke,
much.
but you run all day. You know. Or do you just
Lung,
not
you'd
run
mess, you'd mess up other things, Rahman al-San also. So lung cancer.
You don't say what's
It's
worse.
when somebody has if somebody has UC, then it's a shaila.
You see?
Ulcerative colitis, it's a shaila if they should smoke.
Really?
Yeah,
They should smoke?
they might. If they're a smoker, you don't tell them to stop.
Really?
Really?
Why? What's the
Because however it does it, it relaxes and it causes inflammation to lower,
really?
and so they don't. So it's not as bad.
I'll let my father
Yeah,
know.
I'll go and smoke some
Uh,
cigarettes.
They're not going to tell them to start,
Fat cigars.
Yeah, right?
Oh my
Nah,
god.
that's crazy. I did not know that.
but
It's good to smoke if you have a UC.
no.
I mean, if you already
No,
smoke,
if you already smoke, it calms you.
it helps supposedly.
Yeah.
Don't
But
start
so
it.
then if
Don't
If
try it out.
a guy,
Ed Malinkin.
if a that's a good way to put it. If somebody comes to a doctor and they have UC, you have an 18-year-old guy who comes to the doctor and he's like, the doctor diagnoses them with UC. They should be asking him if he smokes, or they shouldn't really. And if he says he smokes, they're not necessarily going to tell him to stop.
But are they going to tell them no? Are they going to tell them don't stop?
They might not. I don't know if they'll tell him not to stop. They're definitely not going to tell him to stop. I shouldn't say definitely. They're probably not going to tell him to stop. But it's like an up in the air thing. However, for Crohn's, they will tell them, like Crohn's it's bad for.
Crohn's different.
Yeah. So Crohn's they shouldn't. Crohn's it makes it worse.
Have you heard of kombucha?
That's very interesting.
Kombucha.
I've heard of it.
Yeah, apparently it helps him. My father drinks it and it helps him with his stomach.
He's a
No.
doctor. He's not a.
I know. I wanted to
Kombucha has
get
a
his
lot of,
opinion on it.
That sounds Indian.
With probiotics. Whatever.
It sounds
Yeah.
very
Yeah.
Indian.
Gut
with
biome,
scobies
all
and
that,
stuff.
but-
No, it's all around.
Yeah,
No, it's
it's
I'm Amish. It's interesting. I don't know. I don't know but if it helps, it helps. Whatever helps.
Yeah.
That's the beginning.
Yeah.
If it
All right, what do you think about
but-
homeopathic remedies? You ever hear about those?
oh, don't get me started.
Yeah, I appreciate those.
I shouldn't say don't get me started. Whatever. Yeah, there's a place and time for everything. Ace lahov, ace lasnos.
Placebo is nice once in a while.
That's a good.
That's a good way to put it. Okay, so a few halachic implications of diabetes. Okay, so obviously, if somebody's in a hypoglycemic crisis, right, meaning that there's a risk of a hypoglycemic crisis, people can't fast, right? Meaning some people can do shiurim when it comes.
If you're taking insulin,
If they're taking insulin,
it's not
so
an issue, no.
so the problem, well, hypothetically, potentially, it might not be. If they don't have any, the problem if they're taking insulin, right? Then they're just bringing stuff into their body. So then, yeah, they'll cause themselves some hypoglycemia. In fact, people are looking for attention, or to lose weight maybe, or whatever. People are looking for attention will take too much insulin.
Really?
Yeah, so they can go to the hospital.
Bizarre.
And you need to look out for parents. One of the doctor things is you need to look out for parents who are looking for attention and they're giving their kid too much insulin.
Yeah, it's called Munchausen by proxy.
Yeah. What's it called?
No, I know about it.
But okay. Notably, so let's say, like hypothetically speaking, someone needs to fast. So why don't you just hook them up to an IV and give them some food that way? I mean, because in the end of the day, people who don't have a functioning pancreas or whatever, and they're diabetic, are going to need to get other forms of, ways of getting into the body. They run a risk of hypoglycemia because their pancreas is so pooped out, so their mom is not having anything in there. So just hook them up to an IV. So Ramosha doesn't like IVs. Just for the record, Ramosha Feinstein does not like IVs.
Like in general or for fast?
For fast.
Ah, okay, fine.
For fast,
Depends.
meaning if the Torah is matter for you to do something to eat, you're eating according to Ramosha, even though you can do an IV and not eat. Right? Halachically, it's not eating.
If you're matter, if it's mutter, just eat.
And zemutal, okay. He's not into the IVs like a lot of people will do IVs like to help them out, like during a fast. It's not good. Like he's very anti to get hooked up to an IV before a fast. All right. So let's say for Havdalah and Dalakosos, right? So you're dealing with a risk, right? People drink, right? If they're going to drink grape juice or something, right? Or Havdalah, that's a lot of sugar. They shouldn't necessarily be doing that. So wine is low. So it's like,
Yeah, but they
I
need.
mean, let's say for whatever reason they can't drink alcohol, so they need to drink grape juice. Then you're dealing with a problem, right?
But for Abdullah,
So
you
is
just use
wine
any
more
of
healthy
it.
than grape juice?
Sorry?
I mean, because when
Hamar
you
Medina.
look at the both
For
sides
Abdullah, you can
of
use
sugar
any
and
sort of
alcohol,
royal bet.
is like red wine healthier than
Hamar
grape juice?
Medina.
You have to
Probably.
You have tea, you can
No.
use-
I don't know 100%.
I'll tell you.
I don't know 100%. I won't paskin on that right now.
It's a beverage.
But from a diabetic perspective, I would say that it's better. That the wine is better.
In general, maybe not.
So they keep
In general, yeah, possibly because you know.
Beer and coffee.
Yeah, I know.
Beer and coffee.
But
It's a minnow.
right, so
tea.
you use Chamar Medina
It's the only use tea.
for that. Also, so there's the Kavachaim and Mishnah Berurah are both talking about. Let's say someone will be nafal l'mishkav, right? So this idea for like arbakaisis, you can be nafal l'mishkav. Somebody can get a cave rosh, not a cave rosh. Nafal l'mishkav though, being in bed sick, is not a degree where somebody should be. Where some people will be exempt from, let's say, from arbakaisis if it's that hard, right? So there's not a chiyuv to drink wine or grape juice for that matter in our case if they're going to be nafal l'mishkav, all right? That's not a chiyuv, all right. So those are the few halachic implications of diabetes. There are many more. I'm sorry that I wasn't able to give you a more in-depth halachic perspective on it or more in-depth on diabetes. Thank you for your time. Zeh tov, zeh beseder. Thank you for your time. Zeh kef mod b'shvili. This was very fun. Oh, wow. If that an encore, I'll start again.